If you have questions, keep them written down or remember them, and we'll open it up to question and answers right after their slide presentation. So without further ado, I'd love to welcome Mary Beth and Dawn to introduce yourselves and take it away.
Hi
Thanks,
there.
Dean.
Good afternoon, everybody. Thanks, Dean. So we're going to give a little bit of a formal introduction. My name is Dawn Baxter. I'm a lived experience co-facilitator for Behavioural Supports Ontario with my bestie and who happens to be my life partner as well, Mary Beth Wighton. Our anniversary is next month, 19 years.
Wow, congratulations.
Mary Beth was diagnosed with dementia at the age of 45, almost 46, which was in 2012. So Mary Beth, do you want to take it away and give some information about yourself?
Sure, thanks, Dawn. So as Dawn mentioned, I am a person living with a diagnosis of probable frontotemporal dementia, and I'm living well, which is an important thing to know about me. And I am not only working with Dawn as a Behavioural Supports Ontario facilitator, which Dawn's going to talk more about that in a minute, but I'm also the co-chair of Dementia Advocacy Canada, and that will be the second part of our presentation. So we're going to just jump into our slides. Once we get through the slides, as Dean mentioned, we'll open that up for conversation and take it wherever it may go. So over to you, Dawn. Thanks.
Thanks, Mary Beth.
Just tell me and I will switch the slides.
Next slide, please, Dean. Hi there, folks. So we want to tell you a little bit about Behavioural Supports Ontario. I'm going to give you a little bit of background. Mary Beth and I applied for this position, very unique position, I have to say that. And it was actually created in 2016. Mary Beth and I applied together to be co-facilitators in 2019. And very graciously accept the offer once BSO decided that they wanted us as a dual team for a perspective of somebody actually living with dementia and a care partner. So very unique position in itself, and even more unique because we get to do it together. But given a little background history, in 2010, the Ministry of Health and Long-Term Care, they actually funded $40 million towards the development of evidence and evidence-based framework to enhance the availability of supports and services with people with responsive behaviors. Since that time, actually, the support has nearly doubled, which is just fantastic. So seeing the value of those with lived experience is kind of the mantra for BSO, which we greatly appreciate. It helps us to create enhanced healthcare services for older adults in Ontario with complex responsive behaviors associated with dementia, but not just only dementia, mental health, substance use, and other neurological conditions. So it's pretty broad spectrum. It provides enhanced family caregiver supports in the community in long-term care or of the patients or the caregivers residing at home. The coordinating office is in Sudbury and in the North Bay region. Next slide, please. Next slide, please, Dean.
Oh, I switched it on my end. Do you see about the...
Now I just do. Thank you.
Yep.
So the advisory unites individuals with lived experience from across the province to guide BSO provincial projects. We'll go into a couple of those in a minute. It provides us a virtual platform for people to connect through shared experiences. The term lived experience refers to people living with dementia, complex mental health, substance or neurological disorders. Care partners are also included within this group, or anybody, which is anybody who plays an active role in supporting an individual lived with the above conditions or who have lived with the above conditions. Next slide, please, Dean. So what our key responsibilities are is every 2 months we have an advisory group, and Mary Beth and I actually we facilitate the lived experience advisory meetings. We work on different projects and we including collaborations with key stakeholders, healthcare professionals, other organizations. We also develop enriched system linkages with key provincial associates. And we like to deliver education, training, and effective facilitation to promote ongoing capacity building among family professionals and care partners. Next slide, please. Okay, so what this all means, just to give you a bit of a snapshot, is a project that Mary Beth and I are extremely passionate about and excited about is the development of the Research and Aging Social Isolation Bias Forest Guide. Very unique. Bias Forest Guides have been in development since 2002. What the bias forest means is it's people with dementia or their care partners who actually develop these guides. So in our perspective, they should be everywhere. So we have helped develop in collaboration with MARAP, the Murray Alzheimer's Research and Education Plan, their 14th guide, and we're in the process of it now, almost completed. And the topic that we landed on was social isolation, which just happens to be perfect, especially now with the COVIDs. But we actually landed on this topic months prior to the COVID. So extremely relevant, very exciting project. We did a certificate of recognition program, just honoring those in the community for working on the front lines all across all sectors. So that was really exciting. Mary Beth did a presentation on BPSD, and I'm sure gonna trip over my tongue for this one, so I wrote it down. Behavioral and psychological symptoms of dementia. So it's an approach to help support those living with dementia beyond drugs, beyond the medication. I did a presentation. It's called Lester's Legacy. You can Google it. It's fantastic. It is about a gentleman who he became nonverbal, but he was speaking to us from within, which it was his drawings, and his family had no idea. He was with a wife for 50 years, had no idea that he could draw. He started to go to a day program, and these memories and relationships from the past, his voice was very much there, and it comes out in his artwork. It's fantastic. So if you look up Lester's Legacy, amazing. Mary Beth did a presentation about MAID last week. Very interesting as well. We went to the Pioneer Network, of course, virtually, and we met with a group called Pets Together. They live in the States, but they have over 2,000 volunteers, and it's helping people connect with animals. It's internationally. It started in long-term care only. Now they're doing it in schools, people's homes. So they have 2,000 volunteers. They're available from 9 a.m. to 4 p.m. You can just email them and say, hey, you know what? My dad would like to see a horse or a goat or a dog or whatever. And it's amazing. It's actually a truly amazing program. And Mary Beth actually, she was on the COVID-19 task force, and she did a presentation in collaboration with the Alzheimer's Society of Canada. So a lot of really amazing projects on the go. That's very exciting. So next slide, please. Okay, so why should people with dementia and their care partners be involved as lived experience? Well, I would argue that the people with lived experience are the true experts. Who is it that we're better going to learn from than those people, especially those with a diagnosis who are willing to share their stories and experiences? It's not only just their moral and ethical rights, but it's a human right. They have expertise in dementia that lead to better social outcomes and benefits. And professionals, we just all learn. Like, I can't even tell you how much I learn from Mary Beth on a daily basis. She truly is my inspiration and my hero. Next slide, please. So payment for involvement, breaking the stigma. We are so grateful for BSO. We honestly can't even tell you how grateful we are that they honestly and they truly recognize and value our contribution and want our contribution. Our supervisor, Caitlin, always comes to us and says, Mary Beth and Dawn, what do you think? As people living this journey, walking the walk, they always want to know and seek advice from us because we are living it on a daily basis. Um, you know, a lot of these events that we attend, most people that are sitting at the table are there with the company that they work for, and it's part of their workday and they are being paid for it. So why are those like us considered to be volunteers? Just doesn't seem very fair. So anyways, I can't even express it enough. I think more people with lived experience should be brought to the table for their involvement, and they should be supported. You know, Mary Beth has young onset dementia. I can't even begin to tell you the struggles when you still have kids at home and you're so young, and then all of a sudden you lack that income because your spouse has the disease, and yet that spouse needs a lot of care. So it really puts you in a conundrum. Next slide, please.
Thanks very much, Dawn. So we're going to segue from behavioral supports Ontario over to Dementia Advocacy Canada. And just a quick blurb about Dementia Advocacy Canada, known as DAC, is that it's a grassroots of Canadians living with dementia and care partners, and that goes from from the east to the west to the north to the south of Canada. And it's about literally 2 years old just this January, and it has done some fantastic things. We get a lot of requests coming in from organizations across Canada to involve us as people living with dementia. And just an interesting note that, and Dean, you can advance that one slide for me, please. One of the priorities for us is actually reduce stigma. And so, you know, this presentation can't be any more bang on for us than that. During COVID, so let's see, March of last year, Dementia Advocacy Canada really had to take a step back and look at our priorities and say, through the lived experience, we really need to step up and stand up for people living with dementia and care partners. And over the next few slides, you'll see different ways on how we've done that, in particular, again, during COVID. One of the first things that happened in Ontario was the announcement by the government of its exclusion criteria for the clinical triage protocol. And on that list of exclusion was people living with dementia. So what that means is that if I needed a device to help me breathe, then I could only get it if no one else needed it, basically. That's a kind of like a rough way to think about this. So obviously, this is incredible stigma that's associated with this. This is against human rights. And so DAC got very, very busy very quickly to address this stigma. And lo and behold, Ontario actually revoked it. So that's truly, I think, an indication of the power that when you start to combine efforts with other organizations and you focus in on one particular situation, then you can move things forward and deal with those things. Next slide, please, Steve. And as Don mentioned, one of the first organizations that opened up to create a dementia task force was the Alzheimer's Society of Canada. And if you go up on their webpage, you can see the full listing of individuals there. Dementia Advocacy Canada were invited to be a part of this task force. And if you were to think about 5 years ago, we probably never would have received that invitation. But because the task force, which is made up of just incredible minds across Canada, realizing how important it is to have lived experience involved right from the beginning of the design of the task force and all the way through it. And so they've definitely have utilized DAC for that reason. Next slide, please. There's been a number of different things, as we all know, that's happening that is causing great disturbance as Canadians, simply as Canadians. And once again, DAC took action with other organizations in targeting those particular things that we felt were just incredibly stigmatizing and against human rights. And one of the letters that we've created a few different letters, and you'll see I quoted here, this is not a public versus private nor partisan issue. This is a societal issue. And in true Canadian fashion, let us channel that public outrage about recent events into something constructive. So let us use COVID-19 as a catalyst for change. And when you put the words lived experience beside those words, they become even that much more powerful, because we're coming from that place where this truly, this society's, how it's set up, is truly affecting us on a daily basis. And that's why in these two particular instances, these letters, I think carries that much more weight, because again, it is from people living with dementia and our care partners. Next slide, please. So it's, you know, we talk about since COVID, just this information overload, you know, where we're getting this data and information from all kinds of different sources. And it's been very rich information for, you know, authors. One of the things that we've been very pleased is to have our co-author approach have been invited to us and have a number of different number of different articles that we've been able to be co-authors of. And so there's been 4 co-authors for myself that you can see in front of you. And this has happened in less than a year. So for a person living with dementia to be a part as a co-author on, you know, more than 4 articles within a year is just, it's almost unheard of, really. And I think this goes to show us that a couple of things. 1, the impact of COVID, and 2, Canadians across that we're working with value our opinion and want to actually not just have that opinion, but show that we have been a participant by doing that co-author. Next slide, please. So, of course, that all sounds great, but we know for a fact that there's many different barriers for that lived experience involvement. there's a, there's a list here. The one that I really want to focus in on is that lack of meaningful involvement, or feeling as if involvement is just purely tokenism. This is probably, when I talk to my colleagues who have dementia, this is one of the things that we struggle with the most, is that tokenism. And in many situations now, in order to receive money from the government for different research projects, there's a caveat in that, which is you must now have people living with lived experience as part of your team. And so now we're getting, numerous requests. We need you to be part of our team. And so in fact, it's almost overwhelming. But we have to be very careful with that. So what does that actually mean? Are we on the list? And you go check mark, yes, we're on the list. And that's all that we, contribute, or contribute at a very high level, but not at the level that could imply significant change. So for me in particular, I think that's the one I find is a huge barrier to that lived experience involvement and tokenism. Next slide there, Dean. So how do we fight stigma via lived experience? I think that Behavioural Supports Ontario, with its role, is just an incredible example of what we can do when we want to do it. And they've been doing it for years. So if BSO can do this, then really the question is, why aren't other organizations doing it? What are they saying as the barriers, and why aren't we coming up and working with solutions to help get past that barrier? Obviously, you have to have money in your budget, and you have to allocate that money to the lived experience. So that budget just doesn't, once again, going back to that tokenism, but rather you can actually have a budget and pay individuals who are part of that lived experience. And you must involve us right at the very beginning, because otherwise we're just that afterthought. And then first of all, it doesn't feel good to be an afterthought. And secondly, we have so much more to provide as part of the initial conversation than versus midway or at the end. The next slide there. So we know for a fact that involvement leads to better outcomes. We know this by some of the research that's being done involving people with lived experience, and what's the outcome of that. And so we can see here along, this list of individual comments on how these outcomes can be improved. So better research questions, better outcome to the research questions. People living with dementia can help in the actual recruitment of other individuals. We can help with the writing, et cetera, et cetera. So a number of different examples. And for me, I really shake my head when I'm looking at projects or documentations and I don't see lived experience on that. I just think, people are really missing the boat. And, I don't find that content to be as good as it could be. Let's go with the next slide, please. Okay, so we wanted to just kind of go through those fairly quickly because, Dean, I know you have, I think, some other questions that you might want to ask, or if you want to open this up to the attendees. Don and I are going to leave you in, hand it over to you.
Oh, well, first off, congratulations on your anniversary. Secondly, is the two of you are so impressive and inspiring. Thank you for that presentation, and thank you for that work. I think Lisa put it in the chat there. The work that you're doing is impressive and inspiring. So thank you.
Thank you for having us.
Well, and Dawn, to your point, after we met the two of you in preparation for planning this, we now have the Boo-Foo guides on our website. for clients to share, and it's in our budget to purchase some for next year, to have paper copies for clients that aren't as tech savvy. So thank you. I would love to open it up to questions, if there is any questions from the participants here. I do have some questions, if not, that we could have a little bit of a discussion here. But thought I'd first open it up to see if any of the participants here want to put Dawn and Mary Beth on the hot seat.
They must be eating their sandwich.
Okay, that's okay. That's okay. I have some questions here, and really, you answered a lot of the questions that I had in your presentation, but with the January being Alzheimer's Awareness Month, and we're really trying to focus on challenging the stigma, and was the theme of this presentation. We do know that there's a lot of stigma to people living with dementia because of a lack of understanding on what is dementia. I think even 1/3 of healthcare professionals think dementia is a normal consequence of aging or whatnot. So there's a lot of misunderstanding out there. So is there anything that that either of you would say to people experiencing the same issue of that may be living with dementia or maybe supporting someone living with dementia and are experiencing some stigma?
I would tell them that they need to educate themselves. And I'm still doing this now with friends and family. One thing, there's so much stuff out there, especially videos, I find are really, really helpful. And so that's a way that we try, because it's not contagious. Some people or they're uncomfortable. We've gone through the whole gamut, family members that have stepped back, lost friends, try to make new friends, but they don't want to be friends because they don't know what to expect. And it all goes back to a lack of education and people just, you don't know what you don't know. And so the videos that are out there and coming to websites like the Alzheimer's Society, or us sending presentations or inviting people to come to presentations pre-COVID, or on this platform, I think are extremely helpful. So that would be my 2 cents. What do you think, Mary Beth?
One of the things about stigma is it doesn't matter if you have dementia. Stigma is rampant in our society about many different things and many different types of people. And people living with dementia were just one more of, the larger population that is stigmatized against. And so I think it's, when we go back in history and we think about all the types of people that were stigmatized, going back into the 50s, for instance, people, if you're a woman and you worked, that was a bad thing. So you're stigmatized against. Your children were, bullied at school. If you had a divorce, then you're stigmatized. More recently, if you're in a wheelchair, you're stigmatized. Why would someone want to hire you to do amazing work because you're in a wheelchair? So there's so many different examples of stigma. And I think we're just one more of those things. And now it's, how do we get society to get over themselves, I guess, for one thing, to help enable people living with dementia. And, when we talk about money, I think that's one of the big things. It must be tied into that lived experience. So not just the person living with dementia, but care partners, families, children. We have a we have a daughter. What is her experience with stigma? And how do we get that out so that she can share that opinion with other people? So it's getting past the talking. We know the impact of it, and now we have to start the doing. And so again, going back to the example of BSO, why is it that other organizations are not doing that? There's your question. So just some food for thought.
Love it. We do have a question from the audience here. And they are starting it off with a compliment, such a great presentation. And the question is, how do you think Canada compares to other countries in regards to reducing stigma and raising awareness about dementia? And it's from Lisa.
I'll throw my 2 cents in. So interesting enough, Lisa, Lisa's the other co-chair of Dementia Advocacy Canada. One of the things that I was looking at prior to joining today's conversation is an article. It's a big page, actually. It's more than an article on Alzheimer's Disease International. And 18 years ago, DAI produced a document about stigma 18 years ago. And, you know, we're still saying the same thing. And so ADI goes out to all across the world. It addresses stigma in countries, you know, first world countries right to third world countries. And the stigma according to country actually varies. So for instance, in third world countries, if you have dementia, we know stories of people being put out and chained up literally outside, you know, their home, or people being burned to death. So horrific stories in those third world countries. Whereas the first world countries react still very differently in that, you know, we don't involve people with stigma because of them having. So when we compare Canada against these other countries, I think we're also comparing Canada as a rich country versus you know, these many third world countries. And so that, I guess you could say then we are more advanced because of that, you know, because of the finance that we can help support people living with dementia. So, you know, are we up there? Yes, we're doing a pretty good job for sure. And an example of that is actually the federal government of health, who for the National Dementia Strategy Plan, she has created, you know, the minister previous to this minister created an advisory group, and myself and Jim Mann, who has dementia, are both on that advisory group. And there's 2 care partners who are also part of that federal advisory group to the Minister of Health. So I think that really says something about Canada and the stigma. And Lisa, hopefully that answered your question in a long-winded way.
Dawn, any comments?
Well, these girls are the international girls. I am going to say a couple things. I think Canada has a long way to go. I really do, even though that there's a dementia strategy plan that is kind of been implemented. We are quite far behind the 8 ball. And when we compare apples to apples, like our country versus other countries in the same type of financial state versus what Mary Beth was saying, third world countries, I think that we have a lot to learn. And I think that we still have a very long way to go.
We're often looking at Alzheimer's UK and Dementia Australia, who I would say their boat's a little bit ahead of us.
Yeah, right. Because they have the dementia-friendly communities built, you know, the home, like that. Yeah, and that's where my mind automatically goes to, is like, why don't we have that?
And that's a great plug, Dawn, to something that I was going to share here, is that, you know, yes, there's so much work to be done.
Mhm.
But something that I'm particularly a little bit proud of that we have just launched at the Dementia Society through funding through the Center for Aging and Brain Health Innovation,
Mhm.
and in partnership with the Briere Research Institute. We have a website called Dementia 613, and so right now this is just for our region, so the 613 area, but we're trying to have the region's most trusted dementia inclusive resource directory.
Oh, that's
Um,
amazing.
so we're highlighting those businesses that have received dementia friendly training. And so as a care partner or someone living with dementia, we're hoping that you would come to this website in our region and say, okay, great. I see that the Ottawa Public Transportation, those people wearing the red vests, they know a little bit about dementia. So if I get lost or if I'm maybe a little bit confused or whatnot at some point, I can go to someone for help. Or if I want to get into some exercise, this person actually knows something. Um, so we are breaking it down to fitness, exercise and learning, food and beverage. So you could know that your local restaurant, maybe they have a quieter hour every Thursday.
Yes. Dean, I was going to actually ask you food and beverages because this is a
Yeah.
topic that we're touching on right now. So can you request, will they turn the music off? Will they
Yes.
because these are things that when Mary Beth and I go out pre-COVID, we have to go during off hours. You have to sit in a particular area that there's less noise and stimulation. So that's fantastic.
Yeah, health, well-being, and caregiver services, housing, transportation, legal, financial, and safety monitoring. So this has just launched. We've actually seen with the launch of this, like there's been a flood of requests from organizations saying, "Oh, we'd love to be on there." And so this is our nudge back to them and saying, "We'd love to give you some dementia education." And so that's how you get on here.
Love it. Love it.
So one step forward.
Can I push you on a second step?
Yes.
So this is absolutely amazing. And one of the things that we have called for years now is an 800 number
Mm-hmm.
that people can pick up a phone, and doesn't matter where you are in Canada, and you can get help somehow. And when we're talking about comparisons of countries, other countries have this. And for whatever reason, Canada continues to fight against this and not have it. And so these websites like this one is so incredibly important, because until we get that federal one that
Yeah.
unites us all, then, this is, as you mentioned, it's the first step, and it's a great one. So congratulations.
And when we speak about funding and money, we put together for the Public Health of Canada grant, and if we're successful, step 2, 3, 4, and 5 is to create a group with someone living with dementia, a care partner, dementia expert to go do some audits to these organizations and to help them. Yeah, we can do this presentation, but like you need a little bit extra help to say, actually, it's too bright in here, or this quiet space would be perfect. So we have some plans to take it further, but of course, you're always asking for some money here. So we're hoping we'll be successful.
Well, remember us, because we
Yeah.
love
If you can
Ottawa.
take that, sorry, if you can take that, then Dean, remembering what our presentation was about, how do you tie that into lived experience? So if you're looking to have people involved in that who have dementia or care partners, then there is that need to pay them.
Yep.
You wouldn't hire a consultant and bring a consultant in to look at your, your framework unless you paid that person. So this is a really great example and an opportunity for the society to, again, get it to that next step where you're actually paying people then to help you do that.
No, I think we have some exciting announcements coming up in the new year that I can't quite hint yet. But no, we're looking, following the lead of BSO and the two of you. So stay tuned. Yeah. Okay, so thanks for allowing me to share that. I guess the last question is any last words of advice, maybe from the perspective of being a care partner or someone living with dementia? Any last words of advice before we close off here?
You know what? I'm going to tell you words of wisdom that
Sure.
I heard when I went to see Jan Arden at the Walk with Me 2 years ago, that has resonated with me and I try to live by. You have to meet your loved one where they are at instead of trying to pull them back to where they were, because it's like an evolving door and the reality changes. And that was my aha moment. I think that's really, really important when it comes to being a care partner of a loved one, that every day is a new day and it might present challenges, but there's also that uniqueness in that day. And it's so important to be our loved one's voice. But I think we have to stop living in the past to what was and go to what is. And that's actually brought me some solace in this journey, because being a care partner and watching changes is devastating. It's even more devastating when your loved one knows that they are going through changes and they can express that to you, because it just is. But when you start to meet your loved one where they are at in that moment, it makes life a lot more enjoyable. So I think that is something important for everybody to take away. Yeah, so yeah, meet your loved one where they are at. That would be my final words of wisdom. And remember also that dementia is not an older person's disease, and this